this is the last part of our blood pressure series. So we started this blood pressure series, which is a 5-part series on blood pressure, physiology, and pathophysiology. Today we'll be wrapping this series up with the pathophysiology of hypertension. If you're new to this channel, you're very welcome. And if you have been following our classes, you're also welcome back. Thank you so much for sticking with us. Today we'll be looking at hypertension. As always, this pamphlet is available on my WhatsApp channel. Link will be in the description box below. Just click it and it will take you straight to this pamphlet for free. Hypertension, people don't talk about it a lot because it's usually very asymptomatic. When we start to treat hypertension is when it starts causing problems. Things like dizziness, fainting, blurred vision. Then we look at treating hypertension. But in most people, it is asymptomatic. Sometimes there is also no clear cause for hypertension. So that's when we talk about primary hypertension. The same way we have primary hypertension that has no clear cause, we also have hypertension that has no clear cause. We also have the secondary hypertension, which means it has a cause, and once you treat the cause, the hypertension will disappear. So things like sepsis causes a lot of vasodilation, which can lead to low blood pressure, which is hypertension. Once you treat the sepsis, blood pressure stabilizes. Dehydration, which can lead to low blood volume, leading to a low blood pressure. Or once you rehydrate the person, blood pressure stabilizes. So things like that are the causes of secondary hypertension. Once you treat the primary cause, the hypertension goes away. So one thing I want you to note in the pathophysiology of hypertension is that anything that leads to a low blood volume, which is a low cardiac output, and low systemic vascular resistance, which is massive vasodilation, would lead to hypertension. One thing I want you to note in the pathophysiology of hypertension is that the symptoms of hypertension come about as a result of blood not reaching the vital organs. So in hypertension, there is decrease in cardiac output and vascular resistance. Once that happens, the blood is not actually reaching the vital organs, things like the kidneys, the brain. And once that happens, the symptoms produced in hypertension, things like dizziness, fainting, they are the body's way of telling you blood is not actually getting to me, the brain. The brain triggers symptoms such as you start to feel dizzy, you start to get confused. So once blood cannot get to the vital organs, it can lead to these symptoms of hypertension being produced. Anything that will lead to a decrease in cardiac output and systemic vascular resistance, which is causing massive vasodilation, will lead to hypertension. So things like heart failure, where the heart is not, the pumping action of the heart is not enough to push out blood. Once it's not enough to push out blood, there is decrease in the amount of blood actually circulating, leading to hypertension. Arrhythmias, obstruction to the heart. So in things like pulmonary embolism or cardiac tamponade, is actually obstructing the heart from pushing out enough blood. Even though there is enough blood in the body, the heart is not able to push out this blood because something is compressing it. So take a look at this pen, for example. There is enough ink in this pen. Now, if I were to tie something here, if I were to tie something so tight that it constricts or cuts off the ability of this ink to flow down as I'm using the pen, even though there is enough ink in the pen, I still won't be able to write because there won't be enough ink in the actual tip of the pen for me to write. So that's exactly what happens in cardiac tamponade and pulmonary embolism. It blocks it blocks the heart from actually pushing out the blood, leading to a lot less blood circulating in the body and getting to the vital organs. Another thing is vasodilation. Remember, we're looking at anything that causes decrease in systemic vascular resistance and cardiac output. In vasodilation, things like sepsis, anaphylaxis, shock, they all trigger a massive vasodilation. And when the vessels are way too big, when they are so open, even if there's a lot of blood flowing, it's just not enough to fill everywhere. It's not enough. So in vasodilation, in massive vasodilation, things like sepsis, anaphylaxis, and neurogenic shock can lead to vasodilation, which will lead to a decrease in systemic vascular resistance and a decrease in cardiac output or blood volume, a decrease in blood volume. So another thing that can lead to hypertension is hypovolemia. So in hypovolemia, there is actually not enough blood. So in things like hemorrhage, where someone's losing blood, the person is bleeding, there is not enough blood left in the body to pump. In reduced cardiac output in things like heart failure, where the heart is not able to push out as much blood as it used to, and in hypovolemia, where the person is actually losing blood, so there's not enough blood left to circulate through the body. So that can lead to decrease in cardiac output and systemic vascular resistance. Anything that leads to this will lead to low blood pressure, which is hypertension. Remember that in pathophysiology, once you can connect the function to the dysfunction or connect how this function changes in a disease process, you have successfully hacked the code to pathophysiology. In heart failure, the heart is not able to pump out enough blood, leading to decrease in cardiac output. Decrease in cardiac output would lead to a decrease in blood pressure, leading to hypertension. So once you pick any of these examples, that is why I've done these with examples so that you can pick any of these. Once you're able to relate it to the changes, remember anything that affects cardiac output and systemic vascular resistance will either lead to a hypertension or hypertension. Once you're able to pick any of these causes and relate it to a decrease in cardiac output and systemic vascular resistance, you have successfully reached um, how hypertension or hypertension. You have successfully reached how hypertension or hypertension is caused. The last thing we'll talk about in hypertension is a form of hypertension known as orthostatic hypertension. This is a postural hypertension. It happens when people stand up. If you've ever been in the hospital or you've seen people, you've seen aged people standing or people who have been hospitalized for a long time, one of the things you see is at the times they try to stand up, they can get dizzy, or some people can even go as far as fall. So this is what we call orthostatic hypertension. And when you check their blood pressure, you will see that, oh, this blood pressure is actually quite low. We talked a bit about this in our clinical relevance of baroreceptors. In orthostatic hypertension, the baroreceptors are not as sensitive to low pressures. So once people stand up, gravity makes the blood pressure naturally fall. But the body, normally the baroreceptors will quickly pick this up and initiate the regulatory mechanism leading to this blood pressure stabilizing. Now, in things like aging, where the baroreceptors are not as sensitive, it's just a natural part of aging. It's not as sensitive as it used to be. In prolonged immobility, where the baroreceptors have just they've been so used to you lying in one position that when you change it, it takes some time for them to adjust. And also when there is nerve dysfunction. So if there is any dysfunction in the baroreceptors transmitting this signal to the brain, or the brain transmitting the response back to the heart to trigger an increase in blood pressure, when this blood pressure falls, it will lead to orthostatic hypertension. And things that can cause it is Parkinson's, diabetic neuropathy, or Lewy body dementia. We talked about this when we were discussing our high pressure baroreceptor. So please check out part 2 of our blood pressure series. You will understand this a lot better. The link will be in the description box. You can also look at the lesson on that pamphlet. The link would also be in the description box below so that you can understand this a lot better. Hypertension is usually asymptomatic. They don't need to treat it. Once when the only time they start treating it is when it becomes symptomatic. When people are critically ill, they will treat it. But if you're just hale and hearty and you just had a little low blood pressure, most times they just encourage you to drink. And usually when you drink, it would come up. And in cases where that does not happen, then that requires treatment. And the treatment we do, we focus on increasing vascular resistance and cardiac output. So once you treat the cause, if the person is bleeding, you stop the bleeding, replace the volume with either giving another unit of blood or giving fluids, the blood pressure will come up. So in cases like sepsis, anaphylaxis, once you treat things like this, the blood pressure will come up and that reverses hypertension. As always, thank you so much for joining us. I hope that you learned something in this class today. Kindly let me know in the comment section if this class has helped you. Please like, share, and subscribe so that when I post a new video, you would know. If you have any points or any parts that you're confused about, let me know in the comment section and I will clarify you. If you have a topic on anatomy and physiology, or you have a pathophysiology of a condition that you want me to talk about, please let me know in the comment section and I will explain it and put it down to the basics. Thank you so much once again, and I will see you in my next class. By the way, this is the wrap up. This is the last part of our blood pressure series. In our next class, we'll be moving on to another topic on circulatory system. I've got two more topics that I think students really struggle with. So I'll talk about that and then we can move on to the next system that I have planned for you. So let me know what you think.